Hi, it's Matthew Holt with another THCB Spotlight. I'm here with Nikki Tessler. Nikki is the CEO of BeMe Health, which is called BeMe Health, not Beam Health, which is what I thought it was called initially, but it's BeMe Health, which is a relatively new entrant in the mental health space for teens. Nikki, welcome to the THCB. Thanks for coming on.
Thanks for having me. So happy to be
Well,
here.
we've met up a couple of times at various conferences, and you've been promising me that you would show me the new and cool version of the application when it comes up. But first off, let's start with the real basics. Why would teens have any problems or anxiety or any issues, or why would they need any mental health? And has this by any chance got worse in the last 2 to 3 years?
Yeah, it's funny. We started testing the perceived stress scale and as one of the assessments on the app, and we threw it out after literally 100% of teens endorsed that they were stressed. I honestly, yes, COVID, yes, the world issues, yes, you name it, right, has contributed to the teen mental health crisis. But honestly, I think it's done more of a reveal than anything else. I think there's been mental health issues. And finally, this generation has this sense of agency and bullishness about them that's ready to take on what I think is arguably one of the most important, of our lifetime in terms of issues.
So, I mean, you can argue it's both got worse, right, with COVID and everything and anxiety, but obviously, teen by my recollection, yours, I'm sure everyone else, being a teenager was never that easy. You were never necessarily the cool kid. You never quite figured out how. And it turns out that nobody was the cool kid, apart from Matt Dillon in that one movie where he was cool in high school and then was the rest of his life was trying to get it back. But I mean, so I think there's that issue, and then the other thing is that we now are aware there are things we can do for it. So that was the present. Give me a slice of your background because you were involved in this in healthcare for a while before you came to BeMe. So give me a slice of your background of the folks who started the company with you.
Absolutely. So I am a psychologist by training, and used to be at most recently at UHS managing a very large book of behavioral health business. So jumped in the deep end, honestly, because of my daughters, two teenagers who really looked at the mental health system and just didn't resonate for them, being digital natives. So I think there was a lot of thought around here's this mental health industry that to adults is outmoded and archaic. And then you look at these teens who think of things as their way in the world, and look at it really from a digital dominant reality. And something had to be done. And honestly, I knew too much about mental health to sit back. And so jumped in the deep end to co found and be CEO.
All right. So what about a couple of your co-founders? Because they both have some illustrious backgrounds.
Yes, absolutely. So Mandeep Dillon is my co-founder who comes from is a child technology advocate through and through. So while he doesn't have the deep domain expertise in mental health that I do, he does have that child technology, and I would call him an engagement brainiac coming from Facebook. One of his previous companies that he founded, he sold to Disney. And so he has a lot of what I think mental health has been sorely missing, or one of our legacy pain points, which honestly is the idea of experience innovation, or how do we reach and influence teens. What our teens have told us is that it's not just about what they need. You could have the best clinical intervention on the planet. You've got to figure out what they like and what they need. And so he is exemplifies that, as well as a team of teams. So while there are people like me that have the domain knowledge, we've purposefully built a team that has comes and transcends mental health, so that we could finally get that engagement piece right, because these teens require it. I would say even demand it.
All right. And you also have a teen advisory board, right?
Yes, we have a teen advisory board of 166 teens today who are literally building this company with me. And it was probably our biggest superpower.
Fantastic, fantastic. So, all right. So you've been doing this for a few. What you started up in what 2021? Got some funding around that time. Couple of years. You've been working, signing up with health plans, the rest of it. What is the actual product? So we'll get a demo in a second of the actual app. But when you go to a health plan or an Medicaid plan or our employer, what are you saying that you're going to do, and where do you start, and where do you stop, and the rest of the healthcare system take over, and who are you working for?
Yeah, so we're really addressing the whole continuum of care. So when you think about the 4 points that payers, health plans, employer groups, as well as other community enterprise partners look at, they're struggling to reach teens. And so we have these digital assets that I'll show you in a minute, that allows for that engaging technology and also to engage teens. It's been a legacy pain point, non-adherence of teens, right, in mental health. This is no different. And so what can we provide to them where they will actually engage? And then reach, we all know that there's never going to be enough therapists or providers or psychiatrists. And so what else can we give them and or across touch points and in the ecosystem so that we can finally meet them where they're at? And then cost. The EDs and other places that they end up in, or inappropriate admissions to inpatient, or the non-adherence to some of the outpatient programs really impacts cost, as well as the family, right? So there's a lot of cost associated with the parent who has a mental health issue with their teen as well. And so this also gets at cost. And so what we do is we combine engaging technology and human touch. So beyond just therapy and psychiatry, but involving coaching and crisis support, so that we can help all teens become the best versions of themselves.
So BeMe is delivering. Obviously, there's a self-service app which we'll see in a second. But then you mentioned coaching. How many teens, when they get the app, are then moving on to using coaching? And then, do you provide the therapy and the psychiatry? Where do you guys stop, as it were?
Yeah, so we have so on our ourselves, we have the digital interventions that you're describing and coaching. I use two different staffing models for that. On the one hand, I have my own full-time coaches, as well as actually 25 training programs to date of MSW trainee programs, and 10 interns as we speak that are working as our coaches. And then we have white labeled partnerships for therapy and psychiatry. So to your point, that is linked to us, that I do not employ those providers. And then finally, the crisis support, if you hit 1-866 hey BeMe, you're actually within 10 seconds given to crisis. And that also is a white labeled partnership through protocol. And so
So,
it's all part of the app, but some of
okay.
it, is employed by me. Others is linked through
Right.
white
All
partnerships.
right. Well, why don't we turn the app on and take a look at how that operates? Because really, what you're doing here is sort of my previews when you showed it to me before. I haven't seen the fancy new version. Is that it's kind of like it's a substitute for Instagram or something like that.
All right.
Stop.
So when a teen is on their phone, here is the BeMe app. So
Okay.
you click on the BeMe app, and the first thing that you're told to do is check in on your mood. And so when you hit this, you can decide if it's whatever it is that you're feeling. So today I'm feeling really excited because I get to be with you. So here I'm feeling excited, and I would just write, I get to be with Matthew. And
Well,
so
that doesn't excite him, Might as well give up. Okay.
and so when you finish the check-in, so every day I check in, then I can go to my mood crew. So this could be anywhere from my friends to my parents, right? And here's my mood crew, that I can look at and make sure how are teens doing. My friends and my family, how am I doing? And we can put emojis. I can actually text. I can call in the moment if somebody is sad. But that way, within seconds, not only BeMe as a company knows how I'm doing, but so does my friends and family support. So we call this our friends and family, and this is our mood crew. And so this allows for what I'm describing as supportive media, which is a new category. This is where you actually have connection points where you can bring in family and support. And so after I'm done with that, I'm at my feed. And this is just my home place where it's telling me what I need based on the algorithm in place. And so I can do things like draw. So I can, that's for my anger management, and I can share that, or I can just save and close it. Or I can go on videos. And so
Yeah, you're getting a recorded video from a coach there who's telling you stuff to do. Okay.
yes. So between videos and as well as what we call care activities, which is like a mini app store of things to do, we can help, every day telling me what I can do, right? So, for example, the anger that I just showed you is really a distress tolerance skill for dialectical behavioral therapy. Now, as a teen, I just think it's fun to draw something, but what we know is there's clinical rigor attached to it. Well, I can go to coaching. Let's do that next. And say, I'm stressed about a friend. And here, a coaching will get back to me telling me the hours, which are 14 hours a day, 7 days a week. And I can leave and come back. And it'll notify me when the coach is ready to talk. And so I can go to my safety kit, for example. So if you look here, it tells me my whole mood journey. But if you look down on the bottom, there's a safety kit. That way, if I feel like I need support now, I can go click on that. I can do a safety plan and include my parents as well and share that with my coach, my therapist, whomever. And then therapy or psychiatry through my white label partnership that I was telling you about with ThriveWorks. But if I go back to coaches, it says, I'm ready to support. Do you want to share? Yeah, just Nikki. And then what will happen in real time is the coach will give me some tips and tricks, and we can leave that and come back to it. And then on my home feed here, on my Explore feed, what I want to show you is that here there are things made for me, videos, and also quizzes and feedback, right? So if I need to take an anxiety quiz, for example, I can do it in real time here. So we're able to track, everything is deliberate and intentional, where we can track how anxiety is doing, depression is doing, things like the WHO-5 and well-being. And in 2024, when we get to talking about that, we're actually going to share those insights in real time with teens. But back to coaching for a second. It says, it sounds like you're having some trouble with a friend. Yes, give me some tips.
Now this is a real human. This is a real human being, not an AI coach, Rebecca. Right?
That is correct. And then what happens is after we're done with the conversation, when she gives me tips and tricks, when you go back to my here is my safety kit, you can find coaching here, and I can click on my chat with Coach Rebecca when I'm done, and it has a coaching card that I can use whenever I want to. And so that's, the essence of the app is that it gives a personalized, individualized, where AI is feeding everything. So this coach is aware of how I'm feeling. They have my mood check-in. They know which videos I'm looking at. They know which puzzles I'm using, and they're here in real time. And so now they're going to send me some tips, and that's great. Now, if at any point the coach felt like I needed more support, they can actually triage with crisis to be on with me. They can call me directly, right? To also see, they can say, let's do the safety kit together, right? With the safety plan. There's lots that they can do to be there for us. And so this is the final thing before they're going to send some tips. And so whenever I want, I can go back to that. Otherwise, I can stay and just explore different parts of what, matters to me in terms of videos, as well as specific things. I can even, look at what, would be helpful to me. So if I tag something, for example, if I were to put suicide as what I'm exploring or self-injury, that would alert my coaches. It would alert crisis, all these tags to see that maybe we need more support. Just like if my mood check-in is negative, we then bring in the human touch pretty quickly. And so that way we're knowing what works, what's not working, so that we can use that as the teen comes back. And so just to show you finally here on the coaching, you can see the different videos that are given. know if you can hear this, but this one comes with music that maybe you can't hear right now, but it just tells you what to do. And again, this is great because then it's a bite-sized skill-based learning that we can actually give to them, and then the teen can come back at any point. So I'm just going to say, great, thanks. So helpful. And that's it.
Beautiful. And so you have a rotary of coaches who are available, to take on teams at any one time. How many well, give me a sense of the numbers or the ratios, more the numbers of how many teams are just coming on and using the self-service stuff like the videos or the English, and how many are actually going to coaching. Then from there, how many get passed on to either self-select or get passed on to therapy or psychiatry.
Yeah, so about 30% use coaches, and they use
Hang
it
on,
about.
So 70%, so 100 teams come on this. Only 30 of them use the coaching function. The other 70 are using the other functions, using the self-service stuff, not going to
That's
coaching.
that's correct. About 30% use coaches, and then they use it multiple times in a month. Roughly, the average is about 2 times a month that they use coaching.
And I assume there are some who are using a lot more, and a few number who are just using it once. That's interesting. And then of those, do you calculate out of that 30%, how many of them are going on to more standardized therapy?
Yeah, so about under 5% go to therapy.
Okay.
And close to about 5% also use our 1866 Hey BeMe. Now, one of the data that we're tracking this year is
that's the crisis line, right?
the crisis line,
Okay.
exactly. And then the safety kit, which I showed you, the safety plan, that is actually let me show you really fast. If you go to your safety kit and you go to edit plan, so you can go through these steps like friends matter to me. This is being used actually 25%, even without coaches. So not with the parents necessarily telling you to, the therapist, the coaches, teens are using this and coming back to it. So if you look at it, you can continue and then my ways to cope at any time I can remember. For me, music really helps me. So I know to use those as we go forward. The breathing very much helps me. And so this is something that, and this was where you add your parents, you add your therapist, you add your coach, whomever you want, so that they can be involved as well.
I
And
see.
so
So, and if something happens in that, they use the plan, do alerts go out to those people?
that's right. So there's many different types of safety features that alert, our coaches so that they can then support crisis, support the therapist, support the parents, right? They almost serve as a concierge triaging. I don't believe in coaching being just a vertical or a feature in the app. Matthew, it's more of the coach is like threaded throughout the app, providing that individualized, personalized, because there's too much. We've relied on self-report for way too much with this population. That population teen also needs to be looked at in terms of their behavior, right, and observing what they're doing. Like, are they tagging videos or exploring things that are concerning enough that we should get involved so that we can finally be more preemptive in the mental health field and help meet them where they're at before they're at risk or not on even footing.
Yeah, that's interesting because you're kind of halfway between. Originally Ginger, and then who are the other folks? I'm blanking on the company that was that died horribly, but it was trying to assess. If you're done, you can stop screen sharing, Nick, if you like.
Oh.
It, but they was essentially using actually what kids were doing on the phone to assess, how much were they using in the middle of the night or what have you, to assess not just kids but adults, to assess, try and sort of do early stage diagnosis of mental illness. But what you're saying is that you're going to build a picture out of all the different things they're doing, and sort of build a picture of that teen's mental health, and when they go into crisis, have the ability to react to them. That's fascinating. But in general, what you've built here is a sort of not a replacement tool, but a tool that looks more like Instagram slash whatever else they're using now than a typical mental health tool. So that's a pretty interesting. You're saying that 70% of them are basically staying with that. Give me a sense about usage numbers. So if I'm in this, how frequently are teens using it? What I mean, when you say the 70% are using that, how many, I don't know how you're counting it, how many daily users, how much daily use are they getting downloads? What's a good use of this app? And one thing we hadn't mentioned is that one of the reasons why kids are, teenagers particularly, are in, have probably have it worse or seem to have worse mental health scores than they used to, is that, when we were young, there wasn't such a thing as social media and, Instagram and Snapchat and all the rest of this stuff and TikTok, and now there is. So, and there's all the issues about, not being a glamorous supermodel with a Brazilian boyfriend with a super yacht or whatever that seems to be the life, and that they seem to be shown. So, what are some what's your sense of how it gets used and how much it's being used?
Yeah, so we're learning a lot as we speak over like what they're using. So what I can tell you is our retention numbers, like day one is about 56 percent, and day 7 is close to 30%. And then we're about 17-18% retention on day 30, right? So they're coming back and they're using it on average about 13 minutes that they use it at a time. But to your point on user choice, so one of the things we're doing this year that is really exciting is figuring out what the characteristic profile and how often they should be using it, right?
Yeah.
So what we know is if we don't have something on demand, if we don't have something that's in real time, always on, always available, they are going to use social media, and that's the de facto mental health support and of information. So we have to provide that substitute. Now, there are some teens that don't want to change. They want to come in and vent. Others actually are like, equip me with some sort of skills, right? So what we're trying to do is understand the different types of teens, not just gender, age, and those types of demographic information, but literally what their motivation is to use, so that we can then do, if they want just comfort or connection, that's what we're going to provide. If they actually want some sort of a skill-based learning so that they leave being equipped, like when they come on saying, I don't know how to talk to a boy, or I just got rejected from a party, I don't know what to do, that we're able to provide that. And so those are some of the nuances and data collection that we're doing going forward, so that we're not just having these, what are great retention numbers and great clinical outcome numbers, but we're actually understanding the teens and serving them accordingly to hit that personalized experience that's so important.
All right. So let me deviate to 1 second. Right now, there's a lot of concern and crisis around privacy of data and how data is being used against teens. Facebook and Instagram, what do they call it? Meta, being sued by, I think, 55 a number of state AGs around trying getting teens to use a program they shouldn't have been using, young kids, and dealing with their data in a bad way. What do you think? How are you thinking about dealing with this, given that you are working with plans, employers, and the information is being shared? How are you thinking about sort of the issue of privacy, and what should we be doing with this data? How should we be, what should we be looking at for what teens are doing, and what should we be leaving alone?
Yeah, so what we've promised back to my 166 teen advisory board members is that app would be for them. And so it is a private space. So Safe by Design is something that my chief youth officer, who has worked with me from day one, has said that kid's safety assessment has got to be more important than anything else. And so when others, including some, enterprise partners, have said, can you bring the parents in? We've made it a deliberate decision to not allow that space, but to be for the teens. Also because, Matthew, they won't endorse the assessments if they think somebody else is looking at it, right? Or they'll be careful, and then we're not going to understand them. They're not going to understand themselves, and we're not going to be able to have that flourishing lives that we keep talking about. And so what we've decided to do is, for example, with this mood crew, allow the parents as part, so a proxy, right? A different domain for them, so that they can be a part of it. They can understand their teens' moods, but they can't be actually involved. And so we've continued to put privacy at the forefront of what we've done. And we've purposely brought people in that know privacy. We have our chief privacy and youth officer that I'm describing to keep guiding us that way. And I think for some, they've wanted more perhaps revealing of the teens' behavior and data, but we really believe strongly that they have to trust us, because if they don't feel we're authentic, then nothing else will, back to, if they don't like it, doesn't matter how good we are clinically. It's the same about the privacy thing. So when we deal with enterprise partners, we do provide aggregate data. The teen is well aware of what we're doing with the aggregate data, but we're very careful about any type of privacy. And so that control and that choice really belongs with the teen.
But when you say, that on the other hand, right, you are getting, if they're flagging this and they're flagging that and the stuff's coming up in chat, people are looking at it and maybe can intervene. There's a line somewhere there. I'm not talking about, selling them products or whatever advertising, but there is a line there about, someone is paying attention. So how do you cross that? How do you bridge that? How do you cross that
Yeah.
line? Or how do you navigate that issue?
Yeah, so what we do is a couple of things. Is we're very transparent with the teens. So on all the terms of service and the pieces of the app, they are aware that if they are to be tagged, right, if they do endorse or write something like suicide, that this will happen. So that way there's no surprises. We're not sideswiping them. They're aware and know that. The second thing is we're not coming from fear. I think a lot of times in mental health, we've scared teens away by pathologizing or making it like, we're not leaning in, right? Social media is scary. Teens' behavior is erratic and impulse control issues and attention seeking. Watch out. Instead, we're leaning in, saying, you're struggling, work with us. And that way we can intervene now instead of having to get some of the scarier, higher levels of, containment or safety done. So, but to your point, there is a threshold, right? At the end of the day, ethically, safety trumps everything else. And so if we feel that risk level is at that point, that's why me as a psychologist and other clinical team members take safety so important, because if that happens and we do need involvement, we will have to do that, right? And impact that trust. But we come from a place of competence and credibility because we have the teens involved. They're aware, they're in control, and we are working with them every step of the way so it doesn't get to that point where they have to intervene in a way that might be very scary for them or their families.
All right, fantastic. So let's talk about BeMe as a business. So you are not going down the path of making this well, actually, maybe you'll clarify, but your business is not going down the path of making this as an app or like an Instagram sort of by advertising, but instead you're going down the path of selling this as a service to health plans and employers and potentially others as well. So what does that look like when you're going to have that conversation with them, and what parts are they paying for? How are you structuring the sale of this thing? Because if you're not actually using this as a front end to sell therapy services like some others do in this space. So how does that conversation go, and what's your basic business model?
Yeah, so we are an enterprise facing company. So we work with Medicaid and commercial. We have multiple partners in both, as well as our first employer group. And then we have other community partners. And what we've done, the business model is it's essentially a PM where everything from the care activities and the content, coaching, and crisis are all part of that. And then the fee for service is for the therapy and psychiatry. And to your point, I do not, it's not part of my revenue model. And that's purposeful, again, because what I believe is that teens need different tiered levels of support and intervention throughout. And we want to be able to help all teens, some of which might never reside in a mental health, context, others that might need, preemptive support so they don't become at risk, or help at risk so they don't, or if they're in crisis, that we avoid EDs and other things that are not helpful. And so I think the payers, employers, and so forth understand the value proposition, almost like we're a horizontal play in the ecosystem where we can help with different levels of support as well as bolt on. So for some of the payers, for example, they use their own provider network. So that way we give both the care activities, the content, the coaching, as well as the crisis support, and we bolt on to their provider
Yep.
network as well. And so the relationship changes depending on the partnership.
That makes a lot of sense. The one issue, the one question that you must have come up with, I don't know how you're dealing with this, is that those organizations have not in general been great at getting different apps and social media out to their their communities and their members, right? I mean, I'm trying to think about going through my health plan. I found a therapy app that was like buried 17 pages deep, but it wasn't the one that was making a lot of noise. It wasn't the one that, began with better, that was advertising on every single podcast or whatever, or the TV. So how are you gonna get, you've both, given that you've got to get this to a lot of teens, and how are you getting this out there? And you don't have the, you obviously presumably don't have the what was Cerebral was spending, I think, $120 million a year on marketing. I don't think you have that budget, right? So
I do not.
And you have to compete with this Chinese app and this Menlo Park app, which are doing quite well, I hear.
Not too shabby, right? So, that's why I sound trite when I say this, but partnerships are everything. So with our payer partners, are they willing to look at this from an innovative way? And so it involves things like texting, right? It involves things beyond emails. In fact, one of our recent Medicaid partners, we actually took a water bottle, a very cheap water bottle, by the way, and put a QR code on that, and we I think increased over 300% of teen engagement just with that little swag part, because we know they don't use mailers.
Right.
If you gave that to my teen, you can imagine what they would do with that. I don't know that they would even know what that is. And so we've been engaging with our partners different ways. Like for two, I think IHP and Molina in California, we've gone together in the 10 school districts. So we're actually in the schools being able to hand out those QR codes. We're able to build teen ambassador programs in the schools for BeMe and bring them that way. So there's been a lot of effort on building that playbook. And to your point, some of the digital sides, right, that others have used around digital ads and so forth.
And presumably you have a fair number on this system who are not members of the health plans that you sold to. And they're able to use. Can they also get access to coaching? And if I'm a random team and I've downloaded it, I'm using it, can I get access to coaching as well?
For those that are not signed up on partners?
Yeah.
Yes. So today you could, absolutely. But I would tell you, as we evolve with more partnerships, by the end of the year, what we'll probably end up doing is have a free part of the app for everybody, because democratizing access means too much, while at the same time certain features or functions that belong to our partners.
Yeah, that makes a lot of sense. All right. And just as we wrap, state of play of the company, you raised, I want to say 17 million a couple of years ago. Is that right? And then,
yeah,
not quite. Right. And then who were the investors in that round?
Yeah, so Flair Capital and Polaris Partners are our two lead investors. Carrie Walton Penner has also been, and California Healthcare Foundation.
Fantastic. And then you just had another a small infusion from a strategic. Who was that?
Yes, that was Blue Cross Blue Shield of Kansas, who is both a strategic investor, as well as we are doing a payer test bed their contract with 20,000 Kansas teens. So that's super exciting to have them on the board, as well as a payer contract.
Fantastic. Always good to have investors, even better to have customers. They make them both a little better. All right, fantastic. Well, Nikki, good luck with this. It's obviously a really interesting, important market, and there's a lot going on in the world of teen mental health. I've been talking with Nikki Tessler. She's the CEO of BeMe Health, which, as you've seen, is a new, relatively new, and not that new, but relatively new entry in the world of helping teens with mental health, which, as we said, is an area that needs some help. Thanks for your time, Nikki.
Thank you.